right, so thank you all for joining us today. My name is Laura Brown, and I am with RLS and Associates. As Glenn said, we are working with you all to develop this Johnson City Urbanized Area Coordinated Public Transit Human Services Transportation Plan, which is a very long name, and we're just going to call it the Coordinated Plan for discussion purposes today. So I am joined here today with our other team member, A.T. Stoddard from LSC Transportation Consultants. And
Hi, good afternoon.
Thanks, A.T. So we are happy to be here with you today to kind of wrap up the final steps of our coordinated planning efforts. So I'm going to present an overview of the draft final plan and where we are, and a kind of a summary of the activities that we took that took place throughout the study, as well as the conclusions that everyone came to. So we have asked if you can, I think everybody's doing this already. If you're not familiar with Zoom, it automatically muted probably you when you joined. So you'll have to click the little microphone icon. It's probably in the bottom left-hand side maybe of your screen. If you'd like to unmute, you can do that whenever you want to talk. It's a pretty small group. But you can also use the chat feature on there to add comments or something you'd like for us to reference. And we will check those at certain points during the presentation. And as we mentioned, this meeting is being recorded so that we can share the presentation. So again, welcome everybody. I think most of you we've talked to along the way, but it's nice to see you and be here with you again. And if you're new to the project, welcome, and I'm glad to see you here. I'm going to give a quick overview, and I'm going to talk about what coordinated transportation is and what the goals and strategies are, and what those prioritized goals are, because the final step of this project was to prioritize the goals. So while we have this slide up, this is our timeline, but while we have this up, I'll give, in case anyone is new to the planning process, I'll give a little overview of what a coordinated transportation plan is. And that is a plan that looks at the existing transportation resources that are available in the study area. So it could be human service agencies or private or public transportation options. So any passenger transportation options that are available. And then to also look at the transportation needs of the local residents and try to identify the best that we can where the gaps are in access to transportation resources in the local study area. And once we identify what those gaps are and why they exist, and sometimes you might also find duplications in service, but wherever we find those issues, then we bring them to the stakeholders and we talk about how we could work together as a community of transportation stakeholders, being organizations that provide service or organizations that use transportation, or people, residents who need transportation, how we could go about coordinating our resources and trying to address those gaps, either with our existing vehicles and drivers and services and funding that's available, or through future projects that might require additional funding. And so we've identified strategies and gone through a process of understanding public need and passenger needs, understanding existing resources, identifying strategies, and then working with you all, with all the key stakeholders, to identify what in those strategies might be your highest priorities. And so I'm going to present that information today. And this plan is done to satisfy a funding requirement for a Section 5310 program, which is through the Federal Transit Administration. And it's transportation funding for older adults and individuals with disabilities, and particularly, and also people with low incomes. And it can also sometimes offer some benefits to public transit where the public transit resources are not meeting the needs. So that's the regulation behind it, the reason that the plan is done. But it's also a planning process that brings the transportation community together to help just identify what we can do with not just 5310 funding, but any of the transportation resources we have for those targeted population groups that I just mentioned. I'm going to pause here, I guess, and ask Glenn or Mary, did we want to have everyone announce their name? I didn't do that yet. Or do you want to just take attendance from the participant list?
I think Mary was going to take it from the participant list, unless I'm mistaken.
Okay. Okay. Well, that's good. Actually, while I'm talking here, maybe if you could, and sometime during the meeting, I think we recognize everyone's name, but maybe in the chat, just write your name and the organization that you're with. That would be helpful just to double check that we have it all. Okay. Sorry about that. I should have done that first.
No, good idea. I just noticed one person in as a Zoom user, so they're anonymous.
Yes.
That's fine. Just
Yeah.
noticed that. Yeah.
Thank you. Yeah, that's fine. If you don't want to put your name, that's okay too, but would be nice. Okay, so as I mentioned, one of the first things we did was to look at the existing transportation resources that are available to, particularly for older adults and people with disabilities and individuals with low incomes. And this is a very nice list. And again, we're looking at the urbanized area, Johnson City's urbanized area, and the services that are provided in that area. And you can see here about a list of about 9 organizations, and they include nonprofit organizations that might serve their clients or people who are only eligible because they're a client or a consumer of that program. And then it also includes public transportation providers. It also includes taxis and Uber and Lyft type services that are available in the area. And then if you go across this chart, there's a little dot that says what kind of transportation is available by that provider. So you can see there's a really nice range of services available in Johnson City's urbanized area. So good for you guys for making that happen. There's fixed route transportation, volunteer services, non-emergency medical, demand response service, intercity bus, a lot of access, a lot of opportunities. And so the report that you have has information about each of these organizations, as well as contact information in case you or a person in the public comes across this report and wants to get more details or find out about service from those entities. So there is additional information available there. So we took those pieces of existing transportation resources and matched it up with trying to uncover what the demand might be, the unmet needs and the gaps in transportation services. And so the approach was to do a demographic analysis, to hold stakeholder input meetings, which also included then also a public meeting. We had interviews with the transportation providers and agencies, and we conducted a public survey. The public survey yielded about 120 responses, which is pretty good response for an online survey, especially when you consider the input we received through the public meeting and the stakeholder meetings as well. So and the interviews, we got out and talked to quite a few people. Quick overview of the demographic information here. We have the older adult population. As I mentioned, there were targeted population groups for this study. And older adults is one of those groups. And you can kind of see the difference in the older adult population, the percent of the population, a little more clearly in the bar chart than you can in the map. But the map shows densities, and the darker shaded areas are higher densities, but it's always really small on a slide, so it's hard to see. You can see in the chart, though, that just comparison and percentage of population wise, Jonesboro has the highest percentage of older adults, and then Elizabeth 10, and then Johnson City, and then Johnson City, and then you can see the first bar there is a comparison of the Johnson City urbanized area with each of those individual communities. So that kind of helps us measure demand and where services might be needed. We also looked at where individuals with disabilities live and reside, and where there might be a higher incidence of need, where there are more people with that. So again, this is a map to illustrate that information, but there's more detail in the report. We also considered zero vehicle households, and we did that because in an area such as yours, typically those who don't have a vehicle have lower income in their household. Those two things typically go hand in hand in this type of a community. Not so much maybe in New York City or someplace like that, where there's really a lot of density and some subways and lots of public transit. But in your community, there is a correlation between income and vehicles. So we looked at that factor as well. And then also we considered employment and income. And this slide shows the Johnson City employers that have 40 or more employees. So we could look, the dots that are bigger, of course, have higher densities of employers. So we can compare, as we're doing through this planning process, we could compare where those densities are with where there is public transit. And then you can also look at shift times and that sort of fact to understand who has access to the transportation services that are available during those hours. The chart to the side of that map shows a comparison of average household income. I believe it's household income. I can double check that one. But you can see the comparison of the communities, and the bar to the far right side of the chart is the state of Tennessee. So you can kind of see where the urbanized area and each of the communities compares to the state of Tennessee. Jonesboro being the one that exceeds Tennessee's number. I'm going to pause really quickly. Are there any questions? I'm going to look at the chat too, just to make sure. Okay. Seeing none, I'm going to keep moving along. So this slide summarizes the input about transportation needs that we collected through the meetings and through the survey. And there are 9, it's actually a much longer list, but it can basically be condensed into 9 main points, and there are subpoints under this as well. But one is information and awareness. So a need for folks to understand what transportation services are available. You have wonderful resources here and great people who are really caring and really want to help. But we're not sure that everyone knows about it. So from the public survey and just from information we heard, even at the meeting when we brought everyone together, the different agencies that were there learned things about each other that they didn't realize and the services they provide. So each meeting we learned more about each other and just realized that getting that information out as best we can to make more people aware would really benefit the community. Also, number 2, the need for safe and accessible rides, safe bus stops and safe waiting areas so that people are not that they feel secure in using the resources, the transportation services that are available. Access to employment during evenings and weekends was a major unmet need, especially when public transit isn't operating those hours, but people still need to get to work. Staff and driver shortages are an issue nationwide, including in this area. Transportation technology. So improving how we communicate with each other through technology and as well as how we communicate with riders. Transportation for education / colleges in the area. You're fortunate to have some nice colleges in your area and making sure students and residents are connected with those. Same day trip options was identified as a need. So the ability to make a call and get a ride that day. It was a need that came up in every meeting. Right now, it might not be that day. It might be the next day or a couple days, depending on what's available for your transportation services. Other than the fixed route service, which operates on a schedule and you can get on the bus at that scheduled time. Sustaining existing services is a need. So remembering that while we do have gaps, it's important to sustain what we have now and to ensure the continued funding of those services. And then also a need for ensuring that there are affordable transportation options. So for example, if we were to implement evening transportation services, for example, to get folks to employment, a taxi ride might be too expensive on an everyday basis for folks to use to get to work. So can we find an evening option that's affordable and sustainable that could be offered in addition to that taxi service that's also important. So based on those needs and an inventory of resources, we developed some goals and potential solutions to addressing the needs. And before I get into the specifics of that, of course, when we identify goals and strategies, we have to also identify how they can be funded potentially, and also who's going to be responsible. So the plan itself talks about organizations that could be responsible for leading the implementation of goals and strategies. It also talks about potential funding sources for those goals and strategies, and also performance measures. So how do we know that it's working? How do we know it's meeting the goals that we intended it to mean? So all those things are included in the report for each strategy. They'll evolve as you implement them, but hopefully it's a good starting point. It's intended to be a good starting point for you. So in terms of potential funding sources, I mentioned the Federal Transit Administration, or FTA, Section 5310 program, which is called Enhanced Mobility for Seniors and Individuals with Disabilities. And in Tennessee, the federal share for capital projects under this program is 80%. So 80% of the cost if you are awarded this grant, could be covered by the federal share. And on a national level, the federal share for operating assistance is 50%. Operating assistance is not eligible in Tennessee at this time. So we're focused on capital expenses. I am going to talk about mobility management here, however, which is a person most of the time, a mobility manager, which usually we would consider operating cost. Under 5310, we can consider it a capital cost. So it is eligible here in Tennessee. Local match, it's important. I even highlighted it in different colors so you'd see it. Since you have a federal share, there's also a state and a local match. TDOT may be able to provide 10% of that capital match that you need. And then you have a local match left over. The local match can come from your local services, your local agency, from local funds, but it can also come from other federal non-Department of Transportation funds that are eligible. And there's a big list available, and I'm happy to share it with you. I think there's a link to it in your plan as well. There's a big list of federal programs that allow for transportation and can be matched, can be used to match this program as well. So sometimes when we're working together, you might be able to identify, hey, we get federal funding from, TANF, something like that, from Health and Human Services, from a certain program, and we pay for transportation. Hey, if we put a little bit of that money into this, we could get a lot more bang for our buck. So things like that, that's coordination, and that's working together. Eligible capital grant activities in Tennessee include vehicle purchases and a mobility manager. And so a lot of the goals that we've described here include those options as well. And I have a link here on the slides. And this is the link that will also tell you about other funding sources. But the concept that we have here for potential local match is called fund braiding, which might be a new term. It's not necessarily a entirely new activity for some of you. So some of you may be already doing this. But fund braiding is federal funds from one grant program can be used to fulfill the local match requirements of another federal grant program. So this is what I was mentioning just a minute ago. Fund braiding is allowable for 67 different federal programs, and potentially as many as 130 federal programs provide funding for human services transportation. So there are resources out there, and just encouraging research and creativity if you're looking for a way to find that local match to help you get to where you need to go. I'm just going to check if there are any questions. Okay, Emily put a comment, just a note on the current 5310 funding. TDOT is temporarily funding the program at 100% federal this year. Okay, great. This is the last year of 100% federal funding and includes mobility management. Thank you, TDOT. Very good. So now's the time, guys. This is the year to do it. Very good. Well, so I've arranged the priorities here to be as succinct as possible for this presentation. However, there is a lot more information in the plan. And I've arranged them in terms of highest priorities. So we went through a prioritization activity a month or so ago with most of you were there. This is the result of that activity. So goal number 1 was to establish a coordinated transportation framework. And the highest rated strategies under that goal were number 1, to hire a mobility manager for Johnson City Transit and to develop a robust mobility management program that includes that is for both Johnson City Transit and NetTrans. So, so working together, building a robust mobility management program. And mobility management is really simplified as a way of developing strategies for making these coordination activities happen, for making filling the gaps and addressing the needs through transportation access, information sharing, all kinds of activities that you can do. But it really takes leadership. It really takes a person with the heart and soul to do that. Tracy knows that. So goal number 2, ensure funding and resources continue to be available for maintaining existing transportation services. So the highest strategies under that one, funding one, and resources is fleet planning, making sure that vehicles are replaced on a regular schedule and expansion vehicles are procured in a timely manner. Vehicles are really hard to get right now, so this is a tough one, especially if you were planning on a replacement or expansion right now. And it didn't come. So this is a way to talk with each other, work together on fleet planning, keeping your maintenance costs controlled is, partially a partial way to do that is to make sure your fleets are up to date and in good working order. You can work together in that manner to share tools and that strategies. I mean by tools, not wrenches. The next one is driver recruitment effort and support public and human service agency transportation programs. So in an effort to recruit drivers to help address your shortage, some of you may have stronger resources in terms of advertising and outreach to recruit drivers than others, but you still all need those drivers. So there may be opportunities for you to work together to develop recruitment efforts that you can share and strategies that you can share for outreach. The last one is identifying new funding to sustain or expand the job access program, including funding to advertise the program. So Johnson City Transit currently offers the job access program for transportation to employment. That funding is not going to be continued, the existing funding source. So going forward and looking out over the next 4 to 5 years, we need to identify funding to sustain that service and continue to work on addressing the need for transportation to work. Goal number 3, service expansions for access to jobs and colleges. So this talks about really expanding that job access program to include access to colleges other than ETSU, particularly the Tennessee College of Applied Technology. Working on expanding the places that this job access program can serve, and growing that core service that's successful as it is here. And also implementing a shared ride demand response or shuttle service for access to employment, a service that's designed around shift work. So this would take a lot of coordination for or with employers in the area, and it is tricky. It's something that can be done, but it's a tricky thing to do, and potentially a really strong opportunity for the mobility managers in the area to work on. Goal number 4, transportation service expansions. The highest priorities were to explore transportation options connecting cities in the urbanized area for non-emergency medical transportation, employment, and other purposes. So exploring different ways to make those connections efficient, effective, and affordable between the 3 communities, particularly in the area. To seek sustainable funding to supplement the out-of-pocket cost to the passenger. So for that same day trip that might be costly, the stakeholders were very interested in finding a supplement to help the out-of-pocket costs for the passenger. Sometimes there aren't a lot of those trips that are needed. Sometimes it's 1 or 2 here and there for agencies. So, a program to help that person use the resource to get them through a short period of time when they don't have a vehicle or when they're new to a job would be very helpful and go a long way to help clients and individuals. Also consider a first last mile feasibility study to promote access to Johnson City Transit for people with disabilities. And this is really just recommending some research into access to the bus stops in terms, we heard about, for example, some apartment complexes that were up a hill and just a little bit out of reach for folks that might need to carry bags or might just have a difficult time managing that distance. And it's not just that spot potentially. So looking into first and last mile, just the last short distance between where the bus stop is and where the person needs to go, and looking to see if there are ways to address that gap. Goal 5 is transit technology, was also ranked as a high priority, looking into an electronic fare payment system, and then looking for software for paratransit and compatibility with NetTrans in the case of future coordination. So if there was future coordination of trips, regional trips, demand response trips, each of these transit systems has their own software. So there may be a need for a bridging software or further analysis into how to make those work together efficiently. And then number 6, enhanced and coordinated transportation information and referral process, works with Contact 211. So establishing policies that would allow 211 of Northeast Tennessee to receive a call for a trip. I need a trip, and then that call is directly handed off to the appropriate transportation provider or a call center where the trip can ultimately be scheduled. So you have an existing resource here with Contact 211 that could potentially be maximized and really simplify the process for the caller to get all the way through instead of having to make 2 or 3 phone calls to get their trip. Goal number 7, information and awareness. So we've got educating community leaders, developing a coordinated approach to increasing public awareness. So working together on public awareness strategies, putting your great minds together and talking about strategies and resources, sharing a combined effort to talk about transportation that's available instead of just the individual programs. Again, that might be a mobility manager role as well. Conducting mobility manager meetings to discuss the challenges, needs, and grant opportunities that support solutions with agency mobility managers. So as the mobility management program grows throughout Tennessee, not just in your urbanized area, but throughout Tennessee, we expect it to continue to grow. And as that happens, we would hope that your mobility managers would attend those meetings or conduct even some of those meetings and help build the solutions for a comprehensive approach. Goal number 8, enhance transportation service levels for older adults, individuals with disabilities, and people with low incomes. So we have a section about a transportation voucher program for volunteer drivers serving veterans, individuals with disabilities, and people with low income. So it goes, you've already got My Ride, which is a wonderful program. This could be a voucher program that maybe goes beyond the My Ride services that are available and operates a little differently. Identify funding to expand the My Ride program as well. So really continuing to preserve and grow and support that wonderful service. And coordinated travel training for partnering transportation providers. So travel training is kind of a hand-in-hand teaching somebody how to, maybe that's never used any kind of transportation before, how to use it. And each of these programs here probably has someone who can do that for their program. But a coordinated program, travel training program, is someone who can teach you how to use any of these services. So you could move freely on Johnson City Transit, you can move freely on NetTrans just by going through this one program, or even these the senior centers or My Ride, any of them. And fortunately, we had no low priorities. So I only have a couple more slides here to show you. These are the medium priorities. So these got not quite as high of a rating as the others. Under goal number 2, where we talked about funding, it was a medium priority to encourage agencies to consider using a state contract when possible for capital purchases, and also encouraging agencies to hire mobility managers to coordinate and implement structured transfer points or regional services to help address the transportation needs that go beyond the urban area boundaries. We also talk about goal number 4, transportation service expansions. So directly operating or entering into contractual partnerships with private transportation services or other organizations. Those contractual partnerships might help the provider who has some funding potentially to provide service, but maybe doesn't have the capacity to operate service in the evenings, or doesn't have the capacity to do certain trips that are needed. Can we contract with another operator who's already working evenings or already in a certain service area to help address those needs and provide more services? Also studying passenger waiting areas and the accessibility to bus stops to make sure that passengers can safely access and use the bus stop or shelter. Goal number 6, enhance and coordinate transportation information referral process. This one again is to promote Contact 211 as a single point of contact for information about transportation in the urbanized area. So 211 is promoting themselves, and they do a lot of different services. As you know, transportation is one of those things. And sometimes folks don't realize transportation is part of it. So this is a suggestion to really promote the fact that it is an information resource for transportation in this area, and really letting people know it's part of your network. And then number 7, information and awareness. It's the last one. Identify a leader or champions to participate in regional coordinating councils and to represent the Johnson City urbanized area transportation needs. So identifying your leader, your champion, potentially your mobility manager, to really, again, engage in these statewide efforts to build transportation and connectivity for people to be able to get all over your region, all over your state. So that's a quick summary of the goals. This slide, if you can, hopefully it's not too small on the screen, it shows an implementation timeline and comparative costs by the number of dollar signs to implement these goals. So within each goal, there are those strategies that I recommended. So the dollar sign ranges is because some of the strategies are lower cost and some of them will take a little more money and a little more time. So the yellow and green colors are the difference between when it's going to be planned and when it should be implemented. So a lot of it is planning work and some of it is service implementation. So the green is the service implementation goal for it, or the actual implementation. The yellow is the time for planning to get to those goals. Any questions? That was a really quick overview of about 8 or 9 months worth of planning. So. All right. I don't hear any questions. If you have anything you'd like to share, please do.
Oh, just one comment, Laura. I did, yeah, my camera's off, but can you all hear me?
Yes.
Okay, great. I did want to thank all the agencies that participated in this. We had a very good outreach and a very good participation rate of the regional transportation people, whether they were, traditional transportation like NetTrans and JCT or other people. And I just wanted to thank everybody that it really helped.
I second that. Yes. Thank you all. It was a wonderful experience working with you, and I have high hopes for your success. Lots of caring people.
And so the next steps is we will take this before our board at a later date for official adoption. And we will make that plan publicly available as well.
Great.
And this is an update to our old plan. So we do have one. This just, as everybody knows, things change.
That's right. All right. Well, thank you everybody for your time today and your attention and your participation throughout this. It's been a pleasure working with you. And if you have any questions or follow-up, my contact information is on the slide. Or you could also reach out to Glenn or Mary. Thank you.
Thank you.
Take care.